I'm Gary Bebow, CEO of WRHS Health System, and this is my October CEO Connection. Today I have Dr. Guinevere White with me. Dr. White started in our pediatric clinic in August, and she practices with Dr. Melody Moody. I can tell you that ever since Dr. White has started, I've heard so many very favorable comments from not only her colleagues about her competency and her patient care, but also from the general public, and as they brought their children to see Dr. White, just how impressed they were with her as well. So, Dr. White, how's it been going so far since you've been with us?
It's been great. I've really enjoyed my time here so far.
You came out of the University of Alabama.
I did.
Then you did your residency training at Children's Hospital in Little Rock and at UAMS.
Yeah.
And so I know that we first started talking to you to come here about a year before actually you started, didn't you?
Yeah.
Yeah. And so why did you choose Batesville to come to practice?
Well, my husband and I went several different places, and after meeting with different people within the community, we decided that Batesville was just the best fit for us. And so I've always been interested in working in areas that have a need, and from what I hear, Batesville had a need for a pediatrician, and so Batesville is where we ended up.
Well, Batesville does have a need for pediatricians, and I know we've been really looking forward to having you join us. Has your practice been going about the way you expected it to, or has there been any surprises since you've started here?
Overall, it's been pretty much the way I expected it to. We're staying real busy, which is a good thing, and get to see a lot of different disease processes, which is also a very good thing for me from just from a medical standpoint. So it stays very interesting. I'm never bored, that's for sure.
By pediatrics, it includes the ages from newborns up to 18, doesn't it? Isn't that the age?
Yeah, we will see occasionally some kids that are a little bit older, kids that maybe just graduated from high school and that type of thing, and haven't quite transitioned over to internal medicine. So maybe up to 21, but as a general rule of thumb, kind of under 18 for new patients.
Is there a certain age, though, that's kind of the average that you'd probably see?
Probably younger kids, just because when they're in that newborn and first year of life, they come to the pediatrician so frequently. So that's probably what we see the most of, but we see all ages every single day.
So the best way for folks to get to see you is by calling the office and make an appointment?
Absolutely. So the Children's Clinic right across the street from the hospital here, and we're 870-262-2200.
Well, that's really, I'm so pleased to have you here at the hospital. You know, it's the hospital goes as the medical staff goes, and us having somebody of your caliber join us, it's really a feather in our cap. And so thanks for coming aboard, and thanks for coming and being with me today.
Well, it's an honor to be here.
Thank you.
Appreciate it.
The October Employee of the Month for White River Medical Center is Alan Wood from Environmental Services. He's been with White River Medical Center for 4.5 years, and be sure to recognize Alan for his emphasis on safety. At Stone County Medical Center, Jordan Scroggins, LPN, is their Employee of the Month, and she has been with Stone County Medical Center since February. So if you get the opportunity, be sure to recognize both Jordan and Alan as the Employees of the Month. Recently, we've rolled out the Pride standard of behavior, and we've done that rollout celebrations both at White River Medical Center and Stone County Medical Center. The common theme in the Pride standard is I will, and I hope you'll take a time to really evaluate, read, study the new standards of behavior, Pride, and make it become personal, not only for yourselves, but let's hold each other accountable for meeting those new standards. Upcoming events include Health First, which has been known in the past as our Women's Night Out. That's on October 6th from 4 to 7 o'clock p.m. at UACCB. There's still some booth spaces available, and if any of you would like to volunteer at the Health First Expo, please be sure to contact our marketing department. Our community health education is on October 13th, and Dr. Ramon Desikan will be there to speak about palliative care. You know, we just started up a palliative care program at White River Medical Center in July, and it's off to a great start. In fact, previous CEO, we had some presentations by Diane Plemons, and so Dr. Desikan will be speaking about that on the October 13th community education event. Come over at noon on the 13th and have lunch with us and hear Dr. Desikan speak. Each year we have a White River Medical Center 5K run, commonly known as Run the Wave. This year it's scheduled for October 17th. The check-in is from 6:30 to 7:30 a.m. with the race to begin promptly at 8 o'clock. If you're interested in participating this year, be sure to contact Jennifer Doris at 262-1161. Let's hope that the weather's good and that we have a great turnout. In late September, we began our epilepsy monitoring unit on the 4th floor, 4 East, and we're really looking forward to that new service for the people in this community. There's not very many epilepsy monitoring units in the state, and under the direction of Dr. Krishna, we have a 2-bed unit. We anticipate that it will really be successful, and I know based upon existing wait times at other locations that it's going to be really busy for months to come. So I'll give you more updated reports as time goes by, but this is a new service that White River Medical Center is providing, and better meeting the needs not only of the greater Batesville area, but all of north central Arkansas. So stay tuned. I think it's really going to be a great service. In the not too distant future, we'll be starting our emergency department renovation expansion project. We anticipate the actual renovation will begin on December 1st of 2015. We anticipate the project will take somewhere between 12 to 15 months to completion. I'm really excited about the new plans. I think it'll really improve patient amenities. I think it will really help us take more timely care of patients. We have a drive-through area that people will be able to get out of their cars under shelter. And so there will be some really great amenities to this new plan that will really help us do a better job in treating the emergent care for people in this area. So please bear with me or bear with us during this construction period because it will be dusty and there will be disruption as you might expect. But if we can just be patient, I know at the end everybody will be really proud of what we have to work with. Many of you participated through fundraising. I know many of you have been waiting for this to get started. Well, at last we are about to get started. And again, we'll be certainly keeping you all up to date on that project. And I know you'll be really pleased about it when it's finished. This concludes the October CEO Connection. As in the past, if you have any suggestions on how we might improve it and make it more meaningful to you, be sure to give us your feedback.